Good afternoon. My name is Aisha and I'm a pharmacist advisor working at UCL Partners Academic Health Science Network. This presentation is about switching medication compliance aids to original packs in care homes. By the end of this session, you should be able to identify the different types of medication compliance aids, or MCAs, understand the rationale for using original packs over MCAs, find and check all the relevant information on the original pack before administering medicines, locate and check relevant information on the MAR chart before administering medicines, and identify potential errors that can occur during medicines administration from original packs and how to overcome these. So medication compliance aid is a pack or several packs that have multiple compartments divided by time and date. In order to place medications in an MCA, the tablets or capsules need to be removed from their original packaging, which is supplied by the manufacturer. This exposes them to moisture from the air, which can lead to tablet or capsule deterioration. MCAs that you may have come across before include blister packs, Venilink, Dosset boxes, Nomad boxes, Manrex, and Biodose. The rationale for switching to original packs. So the care home use of medicine study, also known as the CHUMS report, was published in 2009 and did not find any clear evidence that using medication compliance aids reduced medicines administration errors. It's also important to note that not all medicines can be put into MCAs, resulting in many residents having medications that need to be given separately. For example, medicines with variable doses, like warfarin, or medications contained in devices, like inhalers. Also, there's reduced capacity to fill MCAs by community pharmacies and hospitals, leaving some care homes having to use original packs without support or training. It's also difficult to identify individual tablets or capsules, which can lead to wastage if a medication is stopped or changed and the full tray needs to be discarded. Errors if an urgent change to medication has been made mid-cycle, but not actioned before the next medication round. Also, the residents not having the right to refuse one of their medicines, which is one of the 6 rights that must be met for when you administer any medication. Finally, the nurse or carer are unable to confirm that the correct medication is being given and that it is in date. For this, you'd be relying on the community pharmacist to ensure that the correct medication and correct strength are being inserted into the Dosset box and that the medications have not passed their expiry dates. All medications administered to residents require the 6 rights to be checked, regardless of administration from original packs or an MCA. These 6 rights include making sure you have the right person, the right medicine, the right dose, that you're administering at the right time via the correct route, and also that the resident has the right to refuse. We'll go through each of these in a bit more detail. So firstly, the right person. To confirm that you have the right resident, you should check the resident's picture on your system or patient file, and you should also check the resident's name and date of birth. Confirm that the MAR chart has the correct resident's name, and also have a look at the dispensing label on the original pack to make sure that this has the correct resident's name. Once you have confirmed that the patient file, MAR chart, and dispensing label all match, you can move on to the next check. Now you want to make sure that you've got the right medicine. So you check the MAR chart, ensuring that you've had a look at the medication name, strength, and formulation. Compare this with the dispensing label, making sure it also has the correct medicine name, strength, and formulation. And then look at the original pack and check the medication name, strength, formulation on that, and also have a look at the expiry date on the side of the pack. Make sure that the MAR chart, dispensing label, and original pack all match. You want to also confirm that you've got the correct dose. So have a look at the MAR chart and check the number of tablets or capsules or the amount of liquid that is required to be administered. Also check this on the dispensing label and make sure that they both match. When administering medicines, you want to make sure that you're administering at the correct time. Have a look at the MAR chart. Is it time for the medication to be administered now? If administering pain relief, confirm that enough time has elapsed from the last dose. So for example, 4 hours after the last paracetamol dose. You also want to check that the maximum daily dose has not already been administered. So for paracetamol, you do not want to go over 4 grams in 24 hours. You want to have a look at the dispensing label and check the number of times the medication should be administered, whether it's daily, twice daily, or more often. When administering medicines, you want to ensure you're administering via the correct route. So you check the MAR chart to check the route by which the medication should be administered. This may be oral, topical like a cream, rectal, nasal, ocular, or via another route. Also check that the additional information on the MAR chart, for example, crush tablet and add a small amount of water before administration. Compare this to the dispensing label and check the directions on the label for how to administer the medication. Ensure both the dispensing label and the MAR chart match. Finally, the right to refuse. Residents who have capacity have the right to decline administration of any of their medications. If a resident declines a regular medication, you can try again later. If the resident still refuses, inform your care home pharmacist of the missed dose. Some additional checks that should be carried out. Check if the resident has any allergies or adverse reactions documented. This can usually be found at the top of the MAR chart or in the resident's file. Check that the medication has not already been given by checking if the MAR chart has been signed or not. You also want to check for any additional information on the medication label. For example, give with food, dissolve in water, or take on an empty stomach. You want to also check the expiry date on the medication box. If the box provided by the pharmacy is in plain white box, you can check the expiry date on the blister pack containing the tablets or the capsule. Double check the medication from the MAR chart carefully, making sure not to confuse the name with similar sounding medicines. Examples of similar sounding medicines include atenolol and amlodipine, propranolol and prednisolone, amlodipine and nimodipine, clobazam and clonazepam. There's also other errors that can occur. Many medicines have packaging that looks similar. So for example, the picture on the left have different medicines, but the same packaging. So we have lorazepam 1 milligram tablets and oxazepam 10 milligram tablets. On the right-hand side, there's different medicines, but the same strength. So atenolol 50 milligram tablets and sertraline 50 milligram tablets, but both have the same packaging. And then at the bottom, we've got the same medicine, but different strengths. So we've got lisinopril 20 milligram tablets and lisinopril 10 milligram tablets. So it's very important to ensure that you have the correct medication, correct strength, and the correct formulation. So in summary, the checks that you want to do on the MAR chart include the name and date of birth of the resident, the name of the medication, the strength of the medication and the formulation, the dosage details, so give 1 tablet daily, additional information, so for this one is dissolve tablet in water before administration, the date, the route, the time for administration, and the allergy status. Summary of checks that you want to do on the dispensing label include the name of the medicine, the strength, the formulation, the dosage details, name of the patient, and make sure that this date on the label is not mistaken to be the expiry date. This is not the expiry date, but the date that the medication was dispensed by the pharmacy. And please remember that the expiry date can be found on the side of the original pack. The checks that you want to do on the original pack include the name of the medicine, the strength, the formulation, and the expiry date, which is on the side of the box or on the blister inside the box. So when you are satisfied that you have the correct medication for the correct resident and you have checked all 6 rights, remove the required medication from the blister and give it to the resident to take with some water. Once the resident has taken the medicine, sign the MAR chart immediately, ensuring to sign the correct box. Then proceed to repeat the above steps for any remaining medicines that need to be administered. If the resident does not take the medicine, ensure that this is documented on the MAR chart. Please note, only to administer 1 medication at a time. Ensure the blister is replaced back into the original pack straight away. Store all medications for 1 resident in the same place and do not mix residents' medications. If you have any residents with several strengths of the same medicine, take care to administer the right dose at the right time. UCL partners have also developed a checklist for administering medications from original packs in care homes. This checklist has been developed for the purpose of receiving feedback from care home staff, and we would welcome your feedback to improve this document. Please send any feedback to contact@uclpartners.com. Please note that an individual checklist would need to be carried out for each care home, even if several homes fall under the same company. So in this checklist, we have the beginning section, which is around training, and that consists of 6 different questions. And the second part is around storage to ensure that the care home has sufficient storage space. To obtain this checklist, please have a look at the UCL Partners website. So case study 1, with Mr. Brown's MAR chart has the following medications on it. Aspirin 75 milligrams dispersible tablets, take 1 daily. Simvastatin 40 milligram tablets, take 1 at night. Amlodipine 10 milligram tablets, take 1 daily. And omeprazole 20 milligram capsules, take 1 daily. The aspirin, amlodipine, and omeprazole are all due in the morning. Can they all be given to the resident in a medicine pot to be swallowed together? If there's any additional information required for any of these medicines, they should all be documented on the medication label and also on the MAR chart. However, it's important to have a look at the medicines and think about what additional information may be required for these. So the first one you can see is aspirin 75 milligrams dispersible tablets. So the answer to this question is no. The aspirin should be dissolved in water, as it needs to be dispersed before administration. Case study 2, the medication original pack is on the left, and the label says fluvastatin 20 milligram capsules, take 1 daily in the evening. Would you give this medicine? What you want to do here is you want to go through the process that we've been through in the previous slides, having a look at the medication name, strength, and formulation. So if you see the medication in the picture, it's actually fluoxetine, 20 milligram capsules. The label is fluvastatin, 20 milligram capsules. So the answer to this question is no, it's the wrong medicine. You would need to contact your community pharmacy or care home's pharmacist to let them know that you've got the wrong medication or the wrong label, and that needs to be amended. So our learning outcomes were to identify the different types of medication compliance aids, understand the rationale for using original packs over MCAs, find and check all the relevant information on the original pack before administration of the medicine, locate and check relevant information on the MAR chart before administration of the medicine, and identify potential errors that can occur during medicines administration from original packs and how to overcome these. I hope that this presentation has helped you to achieve these learning outcomes. Finally, if you are unsure about anything, please contact your care home pharmacist or other local pharmacy team for help and advice. Thank you for listening to this presentation. For more information on using original packs over MCAs, please contact your local care home's pharmacy team. or please email us on contact@uclpartners.com if you have any questions or comments on this presentation.